So anatomy of nasal septum. So coming to the introduction. The nasal septum separates the nasal airway into two cavities. It supports the nasal dorsum and maintains the nasal tip. So it supports the nasal dorsum and maintains the nasal tip. Deviation of the nasal septum can lead to nasal airway obstruction and cosmetic deformity. So anatomy of nasal septum, we have cartilaginous portion, bony portion and membranous portion. So the bony portion include perpendicular plate of ethmoid. So this is the perpendicular plate of ethmoid, vomer, crest of palatine bone and crest of maxilla. So perpendicular plate of ethmoid bone, vomer, maxillary crest and palatine bone. So this is the bony part, bony portion. And then we have cartilaginous portion. Cartilaginous portion is septal or quadrilateral cartilage. So this is the septal or quadrilateral cartilage. And then we have membranous portion. Membranous portion is between septal cartilage and columella. So this is the membranous portion, septal cartilage and columella. So coming to the perpendicular plate of ethmoid, perpendicular plate of ethmoid is continuous with the cribriform plate and then also with the crista galli of the ethmoid bone. Then vomer, vomer articulates with the sphenoid. Vomer articulates with the sphenoid. And then perpendicular plate of ethmoid forms the upper 1/3 of the nasal septum. So this is the upper 1/3 of the nasal septum. And it is continuous superiorly with the cribriform plate and crista galli and abuts variable amount of nasal and frontal bone. And then vomer forms the posterior and inferior nasal septum. And the vomer articulates with sphenoid rostrum. So the same thing, this is perpendicular plate of ethmoid, continuous with the cribriform plate, crista galli of ethmoid bone, and then vomer articulates with the rostrum of sphenoid, and then this is the septal tail. This is the septal tail in between the ethmoid and vomer. Septal tail, rhinoplasty. Importance in rhinoplasty. So we have septal tail extends posteriorly between the vomer and the ethmoid bone. It's additional cartilage source for harvesting, especially during the revision rhinoplasty. Then we have vascular supply. So we have branches from external carotid artery and internal carotid artery. So these are the branches of internal carotid artery and these are the branches of external carotid artery. Sphenopalatine, greater palatine and superior labial. These are the branches of external carotid artery, and ethmoid, anterior and posterior ethmoid forms are the branches of internal carotid artery. And then we have Caselbach's plexus. Posterior ethmoidal artery is not a part of Caselbach's plexus. So Caselbach's plexus in the little's area, anastomosis of anterior ethmoid, sphenopalatine, greater palatine, superior labial. So what is the importance of Caselbach's plexus? It is the common location of epistasis. It is a common location of epistasis, mostly in the young adult and children, due to nose pricking, digital trauma or turbulent airflow. So then we have venous drainage. Venous drainage, sphenopalatine vessels and ethmoid veins. So ethmoid veins into the superior ophthalmic system, communicate with superior ophthalmic system. Sphenopalatine vessels drain into pterygoid plexus posteriorly and facial veins anteriorly. And last slide, this is the septal swell body. So this is nasal septal swell body. It is a widened region of anterior nasal septum and it is located anterior to the middle turbinate at the internal nasal wall. It has venous sinusoids and fewer glandular elements. Thank you.